Today is World Mental Health Day. The aim to raise awareness of mental health issues around the world to mobilise efforts in support of mental health. It also provides the opportunity for all of those with a stake in mental health to talk about their work. Now, just think for a moment about what you went through during the pandemic, what your family went through. I guarantee you it's worth asking the question, are you okay? Reporter Siphosethu Booi joins us from Gqeberha. Siphosethu, good afternoon to you. What are people saying about Mental Health Day there?
Good afternoon to you, Stephen, and you're quite correct when you mentioned the fact that the pandemic really did play its role and part as far as also just shaking up our mental health over the pandemic. And now your mental health problems do range from a variety of causes. Sometimes it's stress, sometimes it's childhood traumas, and in most cases it's also because of debt. But joining me now is, of course, Dr. Luvuyo Vuyisa Machaya, who is situated in the Gqeberha CBD. Good afternoon to you, Doc. Please just give us a bit of a background as far as the mental health issues that people do come across.
Good afternoon, Sethu, and thank you for having me. When we're talking about mental illnesses, we're talking about a group of disorders that present as changes in emotional regulation, in behavior, and in cognition. Contrary to what people believe, that those changes are an individual choice, those changes are actually a reflection of a dysfunction in behavioral issues. They are a reflection of dysfunction in psychosocial issues and other issues that are factors that contribute to one's mental health. There's a long list of illnesses, but for the purposes of time, I would just focus on two. Before the COVID pandemic, it was estimated that 1 in 8 people worldwide live with a mental illness. And that is just talking about those that are diagnosed. And it was also estimated that in South Africa, there were reports that in South Africa, 25 reported suicide in a day. And also in consideration that with one suicide, there's 10 attempts. With the pandemic, it has been reported that there has been 25% increase in the prevalence of anxiety and depression in South Africa, not just in the world. If we look at depression, it is a clinical syndrome. It presents with persistent changes in mood. We're talking about depressed mood, low mood, sad mood, empty feelings, feelings of hopelessness, and this is often associated with a lack of interest in usually pleasurable activities, lack of anticipation of pleasure, a decrease in motivation, and everything feels like an effort to do. I often say to my patients that when you live with depression, every day feels like a battle. The struggle starts in the morning, and the waking up, the getting out of bed, the dressing up and get going on its own is a struggle. And anxiety, if we had time, is one of, the commonly seen mental disorders, which on its own is a syndrome. We present with more than just normal fear, but an apprehensive anticipation towards a perceived threat or danger.
Symptoms where one notices that they do think they are depressed, but they're not sure. What are some of the symptoms that they can actually look out for in themselves?
I think of note is that the symptoms usually are persistent and contrary to the usual stress. It's not something that you can snap out of, It feels like there's something that is constantly pulling you down, something that is constantly eating up your soul, Most patients, they would often describe as that it feels like you are in a dark space, that is difficult to get out of, So on top of the low mood, which in other people can actually be irritable, like I mentioned, that there's change in your usual or baseline kind of functioning. There's impairment in functioning. There's in scholastic, academic, or social functioning. There's a decreased pleasure with social, functioning, and everything feels like so much effort and hard to do. Sleep changes, appetite changes, and also most people, depression will co-occur with anxiety because of many factors, biological factors, that overlap between the causes of anxiety and depression.
This year's theme is Make Mental Health and Well-Being for All Global a Priority. What does this mean to you, Doctor?
Oh, that's an interesting one. To me, Mental Health Day, it is about creating or enforcing awareness about mental health, and this year's focus is about making mental health and a priority, and not just a priority but a priority for all, which is important because one of the important reasons why we have a Mental Health Day is to create advocacy, create communicate inclusion of those with mental health, reduce stigma, and promote awareness in our workspaces, in our workspaces, in our families. And lastly, about mental health, also to create a debate amongst different stakeholders as to how to improve, accessibility of mental health services.
Thank you so much, Dr. Machaya. That was, of course, Stephen, Dr. Machaya, just giving us a bit of background in terms of the things that we should always look out for in ourselves, for starters, and to also answer your question, if we are really okay after the pandemic, Stephen.
Siphosethu, thank you very much indeed. Really do appreciate that story, an important issue that we need to look at.